you can always come back to a little bit of movement if you feel yourself coming out of your body. Thank you all for participating.
Thank you, Raji. Hello, everyone. My name is Joseph Larios. I'm one of the facilitators today. Thank you for having me. I am a local community organizer, but I also sit on the board of HIPMC as one of the co-chairs. And so I'm really excited and glad that this conversation is continuing to happen. You know, health equity and social justice, racial justice are really heavy topics, full of tension. And so we just want to offer a couple of grounding agreements so that we can have the most productive and healthy and generative conversation of all of these necessary things together. And so a couple of things I want to point out to. You absolutely have a right to discomfort in challenging conversations. It's where we can find the most growth is in that. And so please, if you are sensing a sense of discomfort, take note of it. Take note of it. Let us know where that lands in your body. That's always super important to get in touch with. But just know that in this space, discomfort is an immediate invitation to reflect, right? And to figure out why is this uncomfortable? We know it's uncomfortable. It's supposed to be. The good question for us to ask ourselves is why. Next is take responsibility for how much time and space you take up, right? We each have our respective experiences and wisdom and body of knowledge that we're gonna all share together. And so in order to do that, we need to make sure that everyone has the space to speak and to help create and lend itself to the space. Want to give a particular point to cisgendered white males. Please consider taking a listening position. We'll get into more detail for why that's so important. But the other piece is we recognize that, you know, there's a lot of folks from public health, specifically county health here, and workplace environments and hierarchies are a real thing. And we're going to try and minimize that as much as possible in this space. So again, we have folks who work in public health. We have folks who don't have health insurance, all on this one call, having very hard conversations about health equity and social justice. And so again, if we're going to build that all together, let's make sure and be mindful of how much space we're taking. Next, inquire instead of blame. Right? Be curious, be inquisitive. We invite that, we want that, right? We need more people, quite frankly, to be curious and inquisitive about our major health challenges. And so please look for that. Blame is less helpful, right, in this moment. And so inquiry, that's mainly what we would ask of you. And then lastly, focus on your impact of your actions, not just your intentions. I don't believe anyone is here to be malicious or harmful or hateful, hopefully, right? If that is you, please find yourself on a different Zoom call. But just recognize, right, that your actions have impact, regardless of your intention. And so try and be as mindful as possible. And with these agreements, you know, and I'm sure there are others, if you find that there are others that you want to call out, please put it in the chat. That's how we will create our space together. But we find these are four helpful agreements to think about as we're having these challenging conversations around race and health. So I am part of a team called Insite Consultants. And we want to just share with you a little bit of our theory of change, how we come to this work around racial equity, health equity. One, we recognize that this work in a lot of ways is about unlearning, right? Figuring out what are those practices and those stories that don't actually serve us nor the greater good of public health. And so how do we unlearn that, right? This is systems change work. And so what are those things we have to figure out how to stop doing, quite frankly? And in order to know that, it requires a lot of reflection. And so throughout this process, we're going to ask you to reflect with us, to think with us, to look at our own backyard of public health, of which I'm a part of as well, and start to really dig deep. What are those things that public health has to unlearn? Next is around power, right? We believe that this work is really about power and our ability to understand how power works and our ability to understand how we can shift the way power works so that it is shared more broadly, right? Shared amongst all of our community so that we can have the best kind of public health outcomes that we can. But in order to do that, we actually have to look at power. And so we'll be doing a lot of that work today. Last and definitely not least, part of our theory is wisdom at the margins. We learn most about freedom from those who experience the most unfreedom. That is a key tenet. And the answers and the wisdom to address some of our biggest public health issues are out there. It's just a matter of whether or not we're sharing power in space with that wonderful knowledge. And so looking at that, and you'll see throughout this day that we consistently draw on that wisdom that's at the margins. And so ideally you hear something new that maybe you hadn't heard before. And again, that's what we invite. Be inquisitive, be curious. And so if we can, as we transition, right, we've heard these words before, racial equity, right? I'm sure that means a lot of things to all these people that are on this call. So let's start sharing with each other. Please share how you believe a racial equity practice will benefit Maricopa County Health Department and the public health sector. Again, we're looking at county health because that's where we are, right? And most of the folks on this call are from county health. And so please feel free to share in the chat, what would benefit us from doing this? And already we see lives saved. Couldn't agree with you more, Kathy. Absolutely. And so please feel free to put that in the chat. Again, please share how you believe a racial equity practice will benefit Maricopa County and the public health sector. All right, and with that, I'm going to pass it over to Mary.
Hi, everyone. My name is Mary Stevens, and I am also a co-founder at Insite Consultants, and I'm very grateful to be here today. I also teach at Arizona State University. I'm a professor at the university, and I want to thank Rosalind for inviting us into this call today. It is such a unique opportunity for a very diverse crew of folks to learn about your field, to study your field from the outside, and also see the work that is happening already and also the work that needs to continue to happen. So thank you all so much for having us. Joe, would you mind advancing the slide, please? So at Insight, we talk about racial equity in two ways. We talk about equity as power, because fundamentally equity is always about power. Oftentimes we mistake equity for diversity, which is actually about representation. And we're hoping that we'll get through those two definitional differences in a few more slides. But oftentimes people come to it, and the second way that we talk about it is as soil work, that racial equity work is about improving the soil of the work that we have ahead of us. And so in front of us, most people come onto a racial equity call or a workshop and they're like, oh, you know what? I wish I had some tools so that I could have a beautiful, racially equitable garden, whether that garden is my workplace or my family or my community. And oftentimes when we think about the equitable garden, we think of BIPOC programs, so Black, Indigenous, queer programs and initiatives. We think of a website that is representative of all the people that we serve. So it has Black folks and young people and seniors and queer folks and trans folks. So we think of representation in graphics or web design. We think of diverse leadership, how our leaders look different, how they look like the communities that we serve. And lastly, Joe, we think of equal pay. These are the kinds of ways that we conceive of the outcomes of racial equity. We think all of these things, I'm gonna go take a workshop or maybe a 3-part workshop, and I am gonna have the most amazing garden that is gonna be the envy of everyone else. And while we agree that these characteristics are a part of racial equity, and they're a very important part of racial equity, The reality is that we often come to this work actually not having soil that is ready to plant those very important characteristics and those very important material outcomes in. In fact, we come to this work often with a wasteland, a history of dumping, if you will, if we want to continue to use this metaphor of the garden, a place of trauma. This is actually how we come to this work. And it's in this work that we have to do the deep soil reparation, that we have to get into that and till the soil. And guess what? That is not as fun. It doesn't look as cute as going to Home Depot and just getting some plants and putting them in your garden and pouring some water, putting it on Instagram. It's not that easy. We have to do that deep soil work. And oftentimes when people come to us, what is toxic in their soil looks like all white leadership, and not just now, but for decades and decades and generations. So that soil of white supremacy and that soil of whiteness is deep. Political abandonment and lack of social responsiveness. So oftentimes we see institutions and sectors that say, no, we're not going to get political, or that's not our role, that's not our lane. And oftentimes, most often, people see that as political abandonment, as refusing to stand in solidarity with those who are most impacted. Legacies of environmental racism and that drive health disparities. So spatial inequalities, where some neighborhoods and areas are thriving and other neighborhoods and areas are dying. And this is what we come to this work with. And then lastly, and perhaps most importantly, is we come often to the work with the invisibilization of the cultural and historical trauma in the treatment that we've offered or continue to offer. And so these legacies, these diverse stories of trauma, these experiences are not present in the way that we move, in the way that our organizations, and we're not sensitive to them. And when we think about these characteristics, this is what creates that wasteland. And so we want to shift to understanding how racism operates in the everyday. And so oftentimes we want to offer this tool. It's from Race Forward. This is maybe folks on this. In fact, we can drop into the chat. How many folks have seen this tool or a version of it? You can just like put a hand up or drop in like me or not yet. It's just always helpful. Roughly, we say about 30% of people have seen this. It's a helpful way for us to engage in institutional racism. So oftentimes we think we hear systemic racism or institutional racism, and we have individual responses to that. And we say things like, well, that's not my leadership. That's not how I am. That's not how I was raised. I have an interracial family. So we respond to systemic problems through individual lenses. What we want to do today is we want to shift us into a conversation that allows us to exist in the systemic level of racism. We cannot solve systemic problems without systemic solutions. While individuals are such a huge, important part of change, we actually always need to be thinking at a systems level of analysis. Joe, can you hit the bar? So we want to be here today. We want to be in the institutional place. So I'll speak very candidly. We understand, as Joe mentioned, that everybody on here is well-intended and wants to do good. We get that. What we need to do is shift to how do we stand and in that space of institutional work that sometimes is really uncomfortable. That's where we want to be today. Is how do we improve our institutional responses? Joe? Great. I want to think now for a minute. We're going to think about what are the institutional responses in Arizona, specifically in Maricopa County. And for those of us sitting in Phoenix, we want to link for us the ways in which the health disparities here are connected, not only along race, but also along gender and sexuality and citizenship. So we want to also be challenging ourselves to think intersectionally. So we all know that we are living in a pandemic, which I'm gonna just venture to guess none of us have ever experienced, or very few of us, because I know there are other pandemics in the world. So for many of us, this is a new experience. What we are witnessing around us is the grave decline and almost genocidal death of people of color by COVID-19. However, what we do know is that COVID-19 maps almost perfectly on where public health is already being challenged along racial lines. And we're going to show that in the next slide. And I just want to read this. I don't think you can disentangle the disproportionate impact of COVID-19 from the things that we are fighting for in the streets. The underlying root of both is the same, which is structural racism that existed in this country for decades. So public health, COVID-19, housing, spatial disparities, all of those things are intertwined and interlocked. And for us to make the institutional changes, we have to shift to that analysis that can hold all of those things together. I'd like now to pass it to Raquel Gutierrez, our colleague from Public Health, formerly from Public Health, now an independent consultant and a dear friend and colleague. Raquel.
Hi, good afternoon, everybody. Glad to be here. So we're going to move into a short conversation about what is really being unearthed about structural racism related to health in the time of COVID. And so can you go to the next slide, please? We're starting with looking at COVID because as we recognize that this is something that is compounding, that is it's built on other things. So we can see right here, these are the 5 top zip codes that are impacted with COVID-19 this morning. And you can see where they're clustered. And so the question becomes, if we're using our some of the practices for today about being curious, like, well, why is that? Why is that? And so we just wanted to bring your attention into the numbers and where they're at. And Joseph just asked if folks can drop their zip code into the chat box, and we can see how many people on this call actually work or live in these areas. And so we know that public health practitioners and professionals are not exempt from experiencing what others do in their community, particularly if you live in one of these zip codes. So let's move to the next slide. So as we move into really understanding COVID's impact, it's important to be able to look at other issues that are also part of this conversation and have always been. And so you can see here that we know for a fact, this came out maybe 5 years ago, we know for a fact that there is at least a 14-year life difference between North Phoenix zip code, particularly in Northern Scottsdale, Fountain Hills area, and South Phoenix. That's less than 15 miles apart from each other. So we're talking about people living 14 fewer years of their life with their families, with their children, with all of the things that come when you're living fully in your life that are being impacted in South Phoenix. We know issues such as looking at the $1 million blocks and incarceration, which for folks, $1 million block is a block in a neighborhood where the state is spending $1 million or more. We actually have $2 million blocks in some of these neighborhoods. And those blocks are also impacted by the families that live there, and how is that impacting them, not just the person who's incarcerated, but also for the people who are related to them. And that has a big impact. And you can see where the blue circle is. There's a lot of $1 million blocks in that area. And then recreational pathways. So can you imagine, if you're living in this area and you are walking on the pathway, this is the Salt River, one of the Salt River pathways, and you're actually walking next to dumps, because there are dumps right along that whole area that have been there for a really long time, and some of them are still very active. And so Somebody just asked, $1 million block is where the state, yep, is spending money on incarceration on that block. And then also, we recognized last week, I think it was announced that the birthing center at the Indian Hospital was going to be closed. And we know that that maternal health and being able to take care of people taking care of themselves as they're pregnant is really important. And what happens when you lose access to those things, and when your communities don't have a lot of access to those things, let alone losing access altogether. And we can see how all these circles of these issue areas are compounding, one on top of the other, one on top of the other. So it isn't just about, should I wear my mask today? It's, should I wear my mask today? And can I get to the grocery store that may or may not have affordable and accessible food for me? And so again, looking at this notion of access and to quality food, and let's just call these things what they are, right? A food desert just basically means people don't have access to healthy food and quality food. And so let's not like metaphorize it, if that's a word, and just call it what it is. And so we just wanted to make the point that all of these things compound each other. It's also directly a result of structural racism in action. And that's the most important thing to understand, as many we know of you on this call do understand, because of the people that you work with, and you feel that as a human being, and it's overwhelming sometimes. Great. I'm going to pass this to my colleague, Raji.
Yeah,
Real
absolutely.
quick, just to jump in real quick, just to build on Raquel, I think something that that oftentimes goes missed is that there is so much information about the way structural racism, again, not just individual action, but structural racism has created all of these impacts. There's even there is a publication called The Geography of Despair, and it's the environmental racism and the creation of South Phoenix. And it ties all of these things that we're seeing to a history of redlining and segregation. And this is a publication that came out in like 2006. And I know, as I sit on various boards in public health, as I engage in conversations with different leadership in public health, virtually no one has ever read this publication, right? No one's aware of it. Everyone knows about the disparities, right? Especially if you're in public health, it's like, these are the hot spots. But no one seems to have an understanding of like its history to that place. And it always surprised me. And I think just to reiterate again, like why that wisdom at the margins is so important. And again, an indicator of what's been missing as public health tries to seek solutions in these areas. So just wanted to add that. Thank you, Raquel.
Thank you.
Okay, thank you. Thank you for adding that, Joe. That feels like a really important segue. Just wanted to take another moment here, y'all, to have some breathing and to kind of come back to our bodies for the purpose of, for the fact that like the map that we just looked at is intricate, and the things that Raquel walked us through are, for some of us, it might be not new information at all. For some people, it might be brand new, right? And just to recognize that we have folks on this call who maybe have not considered ever the intentional environmental racism of a metropolis like Phoenix. And then we have folks who live and work and grow up in these zip codes, and whose parents grew up in those zip codes, and whose grandparents grew up in those zip codes. And something I just want to take a minute to center while we breathe is the experience of the folks who live there, and to remind us that just because a neighborhood is deeply neglected by the state doesn't mean that it's neglected by itself. And the folks who live in communities are deeply, deeply full and capable of caring for each other in ways that the state could never even touch and figure out and name and understand through any kind of research or institutional perspective. And we have a language, right, that we use institutionally that comes from sort of like a white patriarchal construction of research, which is how we talk about neighborhoods that are predominantly Black and brown, predominantly poor. It's a way that we talk about countries that are predominantly Black and brown and predominantly poor, right? It's global. And it's the way that we discount the expertise and the joy and the life that the global majority is capable of and has been surviving and thriving off of for so long. So I want to take a second here to speak power to and from in the direction of South Phoenix and West Phoenix, in folks of the global majority outside of the United States. So I just want us to really think about that power and think about that joy. And if that's who you are and you know who you are, you know what your story is and your experience is, I hope that in this moment you can feel connected to your own power. And remember that these systems were built this way and the state was never meant to support. And it has always been kind of built on the neglect of folks who I think carry the deepest love and the deepest power and the deepest capacity for really knowing the answer to what it means to live in a healthy way. So with that, we're going to just take another moment, let your eyes float shut. Whatever feels comfortable to you. Everything I give are offerings. So please know you can not do anything that I say. That's totally chill. So I'll just take a second to breathe that in and to take a moment to really sit with the information that you were just given. Because it's dense, it's a lot. But it's also how it was built. And take a second to breathe into your sort of fullest and most present self. If you are a person seated in institution, if you are a person with access to institutional power and you don't come from the zip codes that are most harmed, what do you need to really sink into listening right now? To not be taken out of your listening because you're overwhelmed by information. If you're a community member who's experienced institutional violence for your life and the lives of those folks in your family, then what do you need right now to really come into your fullness? Let this breath do that for you. Remind you that you are an expert in your life. You hold deep power and knowing. Let's just go ahead and take one deep breath together. Nice big inhale. And release. Okay. I'm going to gently pass it on to the next person, but I think, they can take a minute to start.
Thank you so much, Raji, and thank you so much for presencing our body and our spirits, and also the strength and wisdom that thrives and continues to be resilient in spaces where structural violence is so present. So thank you for that. For the last 4 years, Insite has been developing a praxis, a feminist praxis, a Black queer feminist praxis, and analysis around power. We have spent hours and hours and hours in classrooms building curriculum to think about what are different ways that we can think about power that are not always dominated by the age-old sort of white patriarchy institutional knowledges. And I am a person who is white, straight, works in an institution. So for those that might be a little triggered hearing that, that isn't a dismissal. That is to say that there are new ways, and in many ways more powerful ways and tools for us to think about that it can expand our own practice. And so deeply rooted in our power analysis is we build all of our work on Black feminist theory. And so in front of you, you see a quote from the famed and illustrious Bell Hooks. And she says, for any group, especially one with power, influence, or control, there is a center and there is a margin. Where the center has more power, influence, and or control than the margin. So it's a very straightforward understanding of power. She's letting us know that power, Joe, can you go back, please? I'll ask you to advance, thanks. Thank you. she asks us to think about power spatially. And we can see that in the city. We just heard about that spatially, the places that have the most wealth, that have the most affluence, also have the most power. And there has been design segregation to maintain that throughout the city, whether that's dumping at the river bottom, the I-10 freeway being built, Van Buren, where until 70 years ago, Black folks weren't even allowed to come north of that, right? That all power is spatialized, it is embodied, it isn't an abstract notion. And so what she helps us to understand is that if we exist in places of power, that is a protected space. And I, as a white, straight, cisgendered, femme, institutionalized person, has a lot of access to that kind of power. And in many ways, I'm very protected in that space. So we want to offer now a different way of considering power. But first, we have to look at how our sector, the health sector, navigates power. Now we can advance. Thanks, Joe. I appreciate that. So we took this, her words, her narrative, and put it into a spatial construction, because I'm a visual person. Most people are very visual. And so if we imagine that power exists at the center, we can imagine that the rungs that you see, the circles around the concentric circles, are the margins. And the further you move out, the less access you have to traditional forms of power. And I want to uplift what Raji was helping us to understand, that the margins also have power and have narrative and have resilience. And oftentimes it's very disconnected to the traditional or conventional forms of power that exist in the center. So what are conventional forms of power? When we say power, what do we mean? Well, there's a lot written on this. And if we could just do our power workshop, which is 3.5 hours. But for today, we're going to build some shared understanding around power, what we think are quite common forms of conventional power. So if power is at the center, Joe, what kind of things do we think exist in the center? Resources and money. Very simply, that the center controls resources and money. Political influence. Material goods, how things are built, where they're built, what gets allocated, similar to resources. And lastly, decision-making. These are very, very quick ways to understand if you are individually a person who holds power, and or if your institution is a powerful institution, because more than likely you have control of resources and money, or access to that control. You have political influence, or you're able to interweave in political spaces. You have access to material goods, and allocation of material goods is part of the work that you do. And also, and perhaps most importantly, decision-making processes. So we want to talk, we're going to activate the chat. We can go back, Joe, please. I'd like to activate the chat. And I'd like to do an analysis. If power went onto a dating app, let's say that power's like, I'm going to start dating somebody. What kind of person or institution would power want to date? And I'll give you just a low-hanging fruit here a moment. What would be the gender or sex, let's say sex, of a person that power would want to date? We're just going to think through, what are the characteristics of people and organizations that sit right there in the power? And you can drop your answers into the chat, but I'll give you one just right off the bat. What's the sex, right? So male, right? So we can see that people in our society, again, we're US American. We're going to look at this today from a US American perspective. Folks that generally tend to have power are male. What other characteristics of power do we associate? Ooh, cis, hetero, white, male. Good, thank you. So also a gender conforming presentation. So you tend to present as what society thinks you should look and behave like, which we call cisgender. White men. So thank you. Somebody went right for race, because this is actually the conversation we're having today, right? So older. So then we have a generational layer. So folks that tend to have generations. So older, seniors, middle age. What other celebrities? So folks that have big platforms. What else? What other characteristics? Are folks at the middle, they tend to be wealthy. And I want to layer that, generational legacy wealth. Positionality or access to the top. degreed or formally educated. And I want us to think about that term education, because there are a lot of folks out there that have a lot of amazing education, but they may not be formal in an institution. But within our society, formally educated folks have power. And remember, power means that you have decision-making, access to resources, and political influence. Credentialed. Oh man, we just be loving credentials. I work at ASU where every day there's a new credential coming out. That is not unrelated to power. And I like to be very frank about these conversations because I want to grow. I want to continue to grow and unlearn, so I need to be honest. Religious, acceptable religions, right? Somebody brought this up the other day. What religions are acceptable in the US? So that's also something we want to be thoughtful about. There's a lot of prejudice, a lot of challenges around that. Evangelicals. What about citizenship? Let's think about citizenship. In our society, and wait for it, in Maricopa County, let's think about citizenship. So we need to be very clear, and we need to get into those roots of intersectionality. Again, this word that we keep saying about what are the multiple ways that power is given to us, and we are privileged to have access to power, and what are the ways that we are marginalized from that power. And so we're beginning to understand who are the folks who tend to always lead. And I'm going to share with you just a little bit about how I use this power analysis. Anytime I go into a workspace, I do my own power analysis and I find where I am on that map. I'm going to cut the BS with everybody on here almost consistently. I am on the first rung outside of the center. I am a 41-year-old business owner. I have 3 degrees. I have the highest kind of degree that you can have. I have access to money, even if I am firmly middle class. I have food every night. I am able-bodied. I am cisgender. I am heterosexual presenting, which is also really important. Identify as heterosexual. And most importantly, I am able to access that center when and if I choose with some ease. So even if I'm not right in the center, I could probably get there in 1 or 2 phone calls or get close to it. So I want you to think for a moment where you would place yourself, and especially if you're working in the county, and especially if you're not in one of those zip codes, where do you place yourself on this? And that's part of our work for all of us. White women, thank you, Erica. Erica, for the win today, right? So white women may not be exactly in that center, but we are quite close to that center often. And that's part of our work that we have to do. We have to be able to see ourselves within the power dynamic itself. So please advance a slide, Joe. So what Insight has tried to do is disrupt this type of power flow from the center to the margins, because what often happens, we at the center or have proximity and access to the center move outward to the margins. And we oftentimes do this with good intentions and maybe some unexamined white savior complex, or oftentimes what we are not able to see as our own privilege. And we think, oh, I can go out and help people. But what we try to do is disrupt this by saying, those that are closest to the problems, which most often exist at those margins, are actually the closest to the solutions. So there is no firm center in Insight's power analysis. There are multiple centers. And our work ahead of us, and I think this moment, this cultural, historical moment that we are living in, demands that we decenter power as it stands now, the historical center and margins, and begins to think about who are the folks at the margins that have unique solutions to very, very difficult problems. That is the imagination that we must live in, and that is what we are advocating today. And I just want to read this again. This is Lola from MassLib. Those closest to the problems are closest to the solutions. So let me cut right through it. As a 3-degreed heterosexual white woman, I do not know what it means to be living close to COVID-19 in the ways that people in those zip codes know what that is like. I can have empathy, I can be a supporter, and I can be in solidarity. But ultimately, it is those folks facing those problems who have the best solutions because they are living in that space, both spatially and abstractly and metaphorically. So we can advance to the next slide, please. Joe, I noticed can you help us facilitate through this?
Yeah, so this part is meant to be the interactive portion, right? So we've been giving a lot of framing. We did a little bit of self-awareness of kind of our individual positionality, hopefully. What we want to move to now, though, is because remember, back in that 4 levels of racism, we really wanted to focus on the institutional side of how structural racism happens. And so what we want to do is do a little power mapping exercise. We can all do it together. And what's great is that we have so many different folks at very different positionalities, right? So we'll get to have a nice full breadth of a view of what a power analysis looks like for Maricopa County Health. We have a lot of folks here from County Health, from the County Health Department. We have a lot of folks who utilize different county health services and programming. I myself am on the board of the Health Improvement Partnerships of Maricopa County. I also sit on the board of now Valleywise Health Centers and Health Clinics. And so very closely related, right, to the Maricopa County health sector. And so what we want to do is start to lay that out, right? So we're going to go from an individual lens to an institutional lens, and we're going to look at our own institution, right, and how it's set up. And so what I would like us to do is put in the chat and remember that agreement of like how much space you take up and where it's appropriate. If you work with County Health Department, if you work within County Health Department, please utilize your expertise here. Who holds the most traditional forms of power, right? Who would be at the center of Maricopa County Health? And if you could put your answers in the chat, that would be super helpful. Board of Directors, absolutely, right? Anything else? The Board of Supervisors, right? So the Maricopa County Supervisors, right? Those are elected positions. That's the center, right? So if we look at who has that political power, who has decision-making power over money, that's where the start is, right? That Board of Directors and the county supervisors. Who in county health sits at that second rung of power?
So I just want to acknowledge Constance Durr has a question that we will come to, and just when you're finished with this section, I just want them to know that they're acknowledged and we'll come to them. Thank you.
Excellent. Thank you. Thank you. Yeah, it is multiple things all at once trying to manage Zoom, but thank you for that. So yeah, second rung of power. So we have directors and we have managers. Who is in the third rung of power for Maricopa County Health? Deputy supervisors, right? So if I understand this correctly, right? So we have in the center, we have the county board of supervisors, we have the boards. In the first rung of power, we have directors. In the second rung of power, we have supervisors and division managers. Who's in the third and fourth rung of power of Maricopa County Health? Who's outside the division managers? Program managers, right? Right on. So then we start to see the different program managers, the programs that are meant to be in some of those, even some of those areas that with the circles, I would imagine, that we saw on Enrique's presentation. Absolutely. So we'll make that special note. Funders, especially federal funding, right? Major grants. We all probably know Robert Wood Johnson Foundation, right? If you work in public health, absolutely at the center. So who is outside of the program managers? So we're looking at like maybe the fifth or sixth rung of power, fifth or sixth rung. General fund staff, yeah. And the general fund staff, I'm assuming are the folks in direct contact, right? Employees and staff, right? And if you could put like, what type of staff? Like what are the positions? You know, you have contractors. It's kind of like the public facing folks, right? Now, in terms of Maricopa County Health, who is outside of those frontline staff? Voters, right? The general public. Well, we got temp workers, right? We definitely have temp workers before we get to the actual community members and what I would imagine are the users, right? And so, again, we can look at this spatially and just go through it, right? We have the major funders federally, and the grant makers combined with the policy makers at the center. We have the directors right away from there. We have supervisors outside of them. We have the project staff and managers outside of them. And then we have the frontline staff of the projects outside of them. And then from the frontline staff, we have the public, right? In various forms of the public. We can continue to go, right? Which public, right, has more or less power? And then we can start to remember the last exercise we went through. Absolutely. And so we want us to hold that together, because what we're gonna do now is break into small groups. Let me make sure I have this correct. Ooh, yes, I'm sorry, Mary.
Constance's question, please. Let's take Constance's
Oh,
question.
thank you.
Great.
Thank
Constance,
you.
can you come off of mute, please, and share your question, or you can type it in the chat, whatever you're comfortable with. Thank you for your
You can just say it now. You don't even have to say 30 minutes there. I just want 30 minutes there.
We might have caught Constance in the wrong time.
Okay, just.
Constance, if you want to drop your question in the chat, as soon as you drop it, we'll ask you to come off mute whenever you're ready. Cool.
Whenever you're ready.
Yeah.
In the meantime, no, all good, all good. Now that we've had a power analysis, right, what we're gonna do now is break into a few small groups. There's a number of facilitators that will help guide your small group. And we're gonna spend 20 minutes in that small group. And we're gonna go over 2 conversations. And these are usually the words that you all have heard to address, you know, health inequity and racial inequities. Who's ever heard the words diversity and inclusion? Diversity, equity, and inclusion, right? Who's ever heard those words? All the hands coming up, right? Those ideally are a little familiar, right? So we're gonna look at that in our small groups. What does it mean by diversity and inclusion? And what does that mean when we start looking at where power sits? And so let me just check with Constance one more time. Constance, let us know. Oh, there you go, Constance. If you raise your hand, if you want to come off mute and ask your question, and then we'll transition to the breakout. It looks like you're off mute, but I don't hear you. Constance, I'm not sure if there's an audio problem. There may be. If you want to offer your question in the chat, we can go ahead and answer it now. But for whatever reason, I don't think your audio is coming through. As we're waiting for Constance to go in, again, we'll have about 7 groups. And we'll spend 10 minutes on each conversation.
Hey,
oh, there we go. Hi, Constance.
Yes. Can you hear me?
Yes, I hear you. Hello? Is your husband on the line?
Hello.
Yes. Yeah.
So I think maybe that's coming in and out. Let's just move. We'll just move forward. Yeah.
Okay, that works. Ria, are we good? So everyone should be receiving a invitation to join a small group. Go ahead and click join, and your facilitators will hold you through that conversation, and we'll be back for a short report back by the facilitator. Cool? Feel free to join. If anyone has a problem, we can just work with you in the main room. And Ria, can you manage the lobby in case? Cool. Thank you.
Uh-huh. Is anyone having trouble joining a breakout room? I see quite a few people still here. Let me know if you have trouble joining your breakout room. Courtney, are you having trouble? Claudia, Roy. Hi, folks. If you're still here, are you having any trouble joining your room? Claudia? Welcome back. Just waiting for people to trickle back in.
You're on camera, Jose. We got kicked out.
Welcome back, everybody.
To my group, it was so good seeing you. I'm sad we didn't get a chance to say goodbye.
That was really freaking interesting too.
Well, there'll be more. We're gonna bring it now back to a group, but I just want to say thank you to my group. And Vera, thank you for your comment, and thank you, Melody, everybody. It was so good to meet you all. I feel really nourished by our time together.
Absolutely.
All righty. So we wanted to do a little bit of report backs from the facilitators. We'll make it, a little quick so we can get through. I'll go ahead and start a model and then just pass it over if that's cool. So with my group, and again, the conversation was around diversity and inclusion and where we see that in the power analysis. And the main point that our group, they were like, here's the one point to make. And it was, if we don't see diversity and inclusion throughout the stream of power, nothing will change. I was like, that is the issue. The other piece is like, diversity has to be something more than just someone who looks like the people most directly impacted, but shares the experience, but also has the support and the fortitude to resist becoming tokenized. And we talked a lot in our group about how tokenization happens the more that we see that diversity representation move into power, that even then it's hard. So those are the main things that our group wanted to share. And again, thank you to my group as well. We didn't have enough time together. And I'm gonna forward it to Sharifa.
I was trying to unmute myself. My group was really awesome. We mapped ourselves as where we are connected to power. And then we had the conversation where most people were like, oh yeah, where we're seeing diversity and inclusion is at the margins, not necessarily in leadership. And a lot of the group felt, only one or two people felt like they were one rung away, kind of where Mary said she was from power. And then everyone else felt like they were on the very ends of it and not even really for sure what to do in their positionality. And so it was kind of like, yeah, we know that this is happening everywhere, but I mean, a lot of I just try to look the other way because I don't know what to do, and it feels like a heavy lift. And so just kind of this I want to learn more, I want to do better, but I don't quite understand what that means for me in my role and my connection to power. And then we came back here. And then I don't know if my group is here, if anyone wants to say something, but that is kind of the notes that I took.
And also feel free to build upon whatever your person is saying in the chat. We are always welcoming that. Let's move to Raquel.
Hi, yes, wonderful group, great conversation, and not so different from what's already been shared, but I'll build on to sort of some of the nuances. And that is that there was a very, very clear sense that that the diversity and inclusion existed, particularly at the margins, maybe a couple of rungs, maybe in the middle of some of the rungs with some positions, but that those having diversity and having inclusion in terms of systems change wasn't enough if the culture of people getting closer to the system in the middle, even if they are people of color or marginalized folks, come from marginalized communities, experience does not mean that they necessarily will have power if they have to work by themselves. So real emphasis on this notion of people needing to work together, which requires understanding each other's experience within the system, not just as an individual, but what is your experience within the system, and analysis around how do I contribute to that. And the last thing I'll just say, because I think it's very real for folks on this call, is that the inability for the system to be responsive to what really needs to change around power drives people away from the system, from operating in the system as a professional. And so when you see that you actually can't potentially exercise power in the way that needs to be, or that it's not being shared in the way it needs to be, that can drive you away, and you'll look for other ways as a professional to try and find ways to help the larger community. And that has a lot of harm and a lot of burden in it in terms of recovering from that, so you actually can jump in back into the work. And I'll pass it back to you, Joe, and because I can't see everybody.
Yeah, my mom works for the city of Phoenix. And like many people in the city of Phoenix, they always say, I have my official job that I have to do, and then I have my like covert job, all the things that I have to do to provide what my community needs, but is not listed under my official job title. And I'm like, Mom, that's why you're working so much, with no pay. And so we will hear from Mary.
Sure. Do Vera or maybe Melanie want to share with what our group kind of discussed and what we learned? No pressure. I'm just thinking it can be someone else. I know you all had some really, I mean, anybody in our group, but I'm just thinking of you two. I can see you on my screen.
Yeah, no, I'll be happy to share. I think we definitely talked about a lot of the issues that were brought up within what you all have already said. I think the thing that was kind of outside of that was talking about how do you then look at where the center of power is, and is there that ability to interrupt that system by looking at elected officials, and how do we gather ourselves together to be able to maybe flip or interrupt that power base. Mary, do you want to add anything else?
No, thank you. Thank you. I think a lot of it. Vera, do you want to add anything? Or Constance, anyone else from our group?
I was just going to add in agreement with Melanie. Also, the thought was who to look at within that margin or that bullseye, that it wasn't necessarily our leaders. Could it possibly be those that are higher up positions that we as common folk don't usually have an opportunity to get our voice heard directly to them? But yet they're in the position in which they are making the decisions for the county or the state even. And so I guess the question really would be is, how do we gather their attention? Do you go to the public meetings? Do you get on the call so that what we are constantly asking for can get to the people that actually have the direction to make it happen, or at least listen?
Mm-hmm. Thank you both so much. I'll just close with this. Something else that we discussed was the fact that so much of the diversity, especially in terms of representation of bodies, so race and gender, Indigenous folks, Black folks, otherly abled folks, exists on those margins, who are often in direct contact or direct service. And in a moment of COVID, when we think about who is being impacted most disproportionately in our communities, it's also who are being placed on those front lines of direct service within the public health sector. While, and again, this is a generality, but we see a lot of those folks already open to precarity, who is already overly exposed and overly represented in COVID, are also the folks that are then closest. So, you know, there's some really, really troublesome problematics, especially in this particular moment, that we wanted to also highlight. With that, I will pass it over to Raji. I think Raji. I can't see everybody.
Yes, ma'am.
Okay.
Yes, yeah, I'll be brief. Our group had some really nice sharing. I was really grateful that folks shared their just personal experiences, right? Things that they have witnessed and seen at the various departments that folks are tapping into. Something that came up for us, I think, is the distance in the power mapping between like those folks holding the most conventional power at the center, those folks who might be programmatic staff, and then the folks who are being directly served, right? And like just really building some analysis together about like what it means when you are kind of like Joe just shared, like when you're positioned as an employee and you may have experiences closer to those being directly served, and kind of how that makes your role a covert one, right? What does that do for how you allocate resources and how you use your time? And if you are someone who directly reflects community, you might be able to do that well, but also at your health and expense and time and labor. And if you're someone who doesn't have that analysis, then, then a lot of that is probably just going to go towards making sure you're educated so you're not doing harm. And just thinking about that relationship as an interesting one to relate to both center of power and away from it, away from the center of power. We also talked about diversity and inclusion. The word I would use is like optics. We had someone share in the group talking about like flyers, for example, and how it's impossible to find a picture of a family that's not white, that's together, and to make marketing materials. But we also talked about how changing the flyer is not inclusion though, right? And like, what does that mean then when institutions can catch up and have the right pictures, but the same amount of harm is being done, and just being cautious of that. I think folks mentioned tokenizing already. So thinking about all of the ways that institutions can tokenize and do tokenize in the interest of not actually changing their practices.
And last but most certainly not least, we had Zoraida and Ms. Rosalind's group.
Yeah, I'll be sharing or reporting back from that. So a lot of what we talked about has kind of already been named, but we definitely talked a lot about the difference between diversity and inclusion, and how diversity does not automatically lead to inclusion. And furthermore, diversity and inclusion together don't necessarily lead to equity either. All of those are separate things that need attention and effort and time and strategy. We also talked about the ways in which marginalized folks might be in positions of power or relative power, right? And how oftentimes they are running up against a wall. And also they are very alone in their position. So it's very hard for them to use that power to make any sort of substantial change. Usually it's small changes, if that's possible. Something else we talked about is the way that we see equity not being centered in health across the board, whether that's hospitals, whether that's the school nurse, whether that's an ambulance. There's not that sort of framework. There's not that sort of ongoing training and education for folks doing that kind of work. So those are the things that I have. I'm gonna ask if anyone from my group wants to hop in. Let's see. I got a message from Ms. Rosalind Z. We had two folks in our group with Z names. But does Z want to hop in and add a couple things?
Yes, I was talking to Rosalind a little earlier, and I think Sean did an amazing job of summarizing what we talked about. But really, we emphasize the fact that, diversity, inclusion, and equity are very separate things. And to be able to achieve each one, you have to go through the other. So it's sort of a process thing. But one of the things I told Miss Rosalind, and she said, make sure you say this out loud, was, we promote diversity, but we don't promote inclusion. And at some point when you're in these offices, when you're in these meetings, inclusion really needs to be the center, because you hire people because of the diversity of opinion and the experiences that they go through. But when they get to the table, the experiences and points that they bring up might be invalidated because they might not know what's really going on or what has happened in the past and why things are set up in the way they're set up. So it's so important that when you bring people to the table, whether it be people in the community, whether it be people from PhD, masters, what have you, that their voices are valid and their voices are heard at the table. And I think that is a big shortcoming that we have, and I take it up in a space. So yes.
Can I chime in on that?
Thank you. Oh, absolutely, Melanie.
Yeah, and I think that's such an important part and an important point, especially for those individuals who may be you know, I'm at a director level. And oftentimes going to meetings, it feels traumatizing often, that your voice is not heard, it is not accepted, it is not validated. You are a voice in the room that is often made to feel as if you are not smart, that you are not intelligent, that you are not educated. And so it is traumatizing often to walk out of rooms or settings like that. So I just want to validate that point on a very personal level, that absolutely is the case many times when you're coming out of meetings at public health.
Thank you so much.
Thank you, Melanie, for sharing. And again, for inviting us to this. Mary?
Thank you so much, Melanie, for sharing that vulnerability and that truth that so many folks feel. And as we mentioned and talked about in our group, and I say this now to the whole group, we are out of time for doing things the old way. We're out of time. And I say that as a very privileged white woman, and I'm calling on the other white folks on this call who are in positions of leadership. We are out of time. And our hope today is that by being in this conversation, even if it's been disruptive or a little uncomfortable, or maybe you just flat out didn't appreciate it, we really, really hope that this could be the beginning of a conversation that changes, because we need everybody at this table. And again, I'm going to go back to Lola's words and say that those who are closest to the problems are closest to the solutions. And so as we move forward, we want to close today, and we only have about 10 more minutes, with equity. Insite has spent years developing our own definition of equity. We take real issue with the current definition that is actually quite abstract, that says when race and gender no longer determine outcomes. That's a really wonderful idea that we can hold to be true as well. But for Insite, equity is an action every single day, and it is about power. It is fundamentally about power. So we want to walk you through the 3-part definition that we have developed over the years, and we're continuing to develop. Our practice is culturally and intellectually responsive to what we learn every day from people like Melanie, from Rosalind, from Sean, from Lola. Equity is power sharing. So we've been having a conversation today about where diversity and inclusion and power lie. And we all seem to agree across the board that at the center of power, the public health sector has not been effective at power sharing. So we have diversity and inclusion only way at the margins, where there is less resources, less decision-making. So if we are really serious about doing equity work in the public health sector, then we are talking about sharing power, divesting in the center, and investing power in the multiple spots around the margins. So I'm going to read this definition: power sharing with those most impacted by disparity in leadership, decision-making, and control of resource allocation. That is equity in action. It looks like sharing power. It builds off of the divest and invest model. We divest in the center and we invest in dispersing our power. It is a transparent process. And let me just make it really clear. That means we don't say, oh, I'm uncomfortable with what I heard, or somebody said something in a tone I don't like, and therefore they're no longer invited to be a part of the conversation. It says, this is a difficult conversation, and I am hearing and getting feedback that doesn't necessarily make me comfortable, but is necessary for us to grow our field and for us to meet the challenges that 2020 has called upon us urgently to meet with moral courage and moral imagination. And we're only going to get there by sitting in our shit. We're only going to get there by being uncomfortable. And we're only going to get there if we are transparent about the things that we have not done well, so that we can grow and become strong in the things that we do. And then lastly, Joe, do you want to take political solidarity, or would you like me to take that?
Yeah, I'll jump in there. Political solidarity is so important. And I think it's part of what folks were alluding to, right? Of like, oh, it's so hard. And it's like, yeah, it is definitely hard. We're talking about hundreds and hundreds of years of systemic racism. And so being in solidarity with those on the margins is key. And our definition, right? Political solidarity with those most impacted by disparity in public and in accountable ways that eliminate disparity by design, right? System's not broken, it's designed this way. It's no wonder there's so many circles in South and West Phoenix. And we are always at the top of the charts of health disparity. It's been like that for a very long time. And guess what? People from these areas have been determining and defining for themselves what we need. And if we could just get out of the white saviordom of trying to program the answer for them and instead figure out how do we just get behind the solutions that people are already talking about, right? That's less stressful to come up with like the right program, the perfect program. It's far less stressful than to just say we're in solidarity and we are behind what people are saying they themselves need. And so, you know, I will say this, just in my time with South Phoenix Healthy Start, which is one of those only programs I have ever seen named the centering of Black lives, of Black babies and Black mothers explicitly. You know, where is the Black culturally centered birthing center? We know we need it. Where is that? There's doulas in South Phoenix and birth workers in South Phoenix calling for that, saying, if you want to switch the infant and mother mortality rate that is 3 times the rate of their white counterparts, if you want to switch that, give a cultural birth center ran by the people who are directly serving this community. And that's political solidarity. And all you have to do is figure out how do we do that and get out of the way. And I think that's so important. So Mary, you want to continue on?
Sure. Can we go to slide 29? So we're going to close out, everyone. And we want to thank you so much for taking the time and spending your time with us and allowing us to be a part of your process. We don't take it for granted. It's an honor to be a part of this conversation. I've learned a lot. I think our whole group has. We want to leave you with 3 best practices that you can start tomorrow. Always listen and center the leadership of those most impacted. We know that many of us may not be used to doing that. As a white woman, that's a practice I had to learn. That is the practice of equity, is recentering and sharing power. Ensure and uplift the security and health of Black, Indigenous, Latinx, queer, trans, migrant employees during this pandemic. We cannot afford to overlook the racial disparities of COVID on communities of color, on queer folks, and on migrants, and on folks who are incarcerated. They are the most impacted, and therefore, as an act of solidarity, but also beyond that, as a collective community holding each other together, we have to ensure that those who are most impacted are not always on the front lines. Their safety has to be a priority. And then those of us who sit at the center or close to that center when we do that reflective practice, we must all as a collective community commit to changing diversity, inclusion, and equity in the center of power. The divest and invest model, not just on the margins. That is what we are being called to do. And that is the work ahead of us. And we're excited to be in this in solidarity with everyone in the public health sector. With that, I'll turn it back to Joe and say thank you so much for having me. It's an honor to be here with you all.
I will also say thank you so much for this opportunity. And I am actually going to pass it to Ms. Rosalind to close this out.
And I absolutely want to say, I'm not sure why my camera isn't on. Something happened. There it is. But I want to absolutely thank you for joining us in this conversation. It's a very meaningful conversation. And we really had some real experts in the room to hold this for us. And when we have this conversation, sometimes there's impacts and trauma still yet in our community. So I just want to ask those who are in this space, Raji took us through breathing. There are those who are in this space that may be feeling some things. And Raji, I'm going to pass it back to you to take us through a closeout breathing. But I also want to invite those who are in this space next month to follow up with what we discussed today. We want to talk about the impact of trauma that our communities suffer when these type of lack in, we lifted up transportation, we lifted up mental health care, we lifted up all the things that intersect with our needs in this community. So we'll have Dr. Carly-Ann Dawson next month on the 18th. We'll send you out information and she'll talk about the impact of trauma and how we heal as a community. And so Raji, I pass it back to you.
Thank you, Ms. Rosalind.